Hi, so you just signed up for DNP school, or you're thinking about signing up for DNP school. I'm going to tell you what you need to know, what you can expect. Let's begin. So you're getting ready to start DNP school, or you're in DNP school in the first classes and you're like, I don't know what to expect. Let me break it down for you. Remember, DNP school is roughly a 2-year process, so you got to be mentally prepared to dedicate the next 2 years, plus or minus, of your life to your school, to your education. You will be expected to complete traditional coursework, so you're going to have classes that are going to prepare you for your practicum or your project, which is traditionally toward the end of the program. Most DNP schools are online, and you can complete most of your traditional classwork online. But some schools may have what's called a residency requirement, where you're going to be expected to travel to that brick and mortar school so many times, either per year or per program. So they may only require you travel there once during the entire program or twice during the entire program. So that's something to consider if travel can be an issue for you. So just keep that in mind. Some schools have residency programs and some do not. So now that you're there, you're here, we're in DNP school. What are we going to talk about? Let's talk about our practicum and project. So you've completed all of your preparatory coursework, right? So all of the didactic, if you will, all your classes. But now you're getting into the project portion, or the practicum portion of DNP school. Remember, it is an evidence-based project and it's focused on quality improvement. All of the courses that you take leading up to the practicum are going to prepare you for that practicum. So the quicker you can figure out what project or what quality improvement idea you have, the quicker you can figure out what you want to do and focus on, the easier time you're going to have, because all of your prep work, all of your courses are going to keep building and building and building on your project idea. Okay, so what I recommend, because a lot of students are like, I don't know what to do. I don't know what to focus on, what to start with. Where do I begin? So my biggest suggestion is that you go and speak with your organization. Speak to your employer. Number one, for support. You want to have their support. Let them know you're in DNP school and that they should know that you're going to have to complete some type of project. But secondly, what's going to help you is, not once you have the support of your organization or your employer, then you can present it as you're there to help them, because you're there to help the organization improve their practices, improve how they operate. So you might want to conduct a needs assessment, and a needs assessment is basically a process of identifying how to bridge the gap between where we are currently and where we want to be, right? So what are those things that we want to improve upon? If you have a quality improvement, a QI committee, that's going to be a really great place to start, because they know and they've been tracking the data of your organization, so they know exactly where there's room for improvement, right? So I want you to think about patient cases that you've encountered or clinical scenarios that you've observed. You're going to look at that quality improvement data, and you're going to look at other data that's specific to your organization to help you narrow down to focus on what needs to be improved. What project can you take on as a DNP student to help your organization? So once you have an idea of what's going on, maybe you go to the quality improvement committee and they tell you, look, we're having an increased rate in CLAPSIs, or an increased rate in CAUTIs, or PIV infiltrates. These are great quality improvement projects that you can use for your DNP project. So once you have an idea of where you're going to go, even if it's just a broad idea, CLAPSIs, CAUTIs, infiltrates, whatever, ventilator-assisted pneumonia, things like that, if those rates are a problem, if falls are a problem in your hospital, once you have a general idea of where the problem is that can use some room for improvement, conduct a research of the literature to identify problems or practice recommendations. Okay, because chances are whatever problem you're encountering in your organization is not unique, and other organizations have also encountered the same issues. And chances are they've already done steps to take to improve those issues that they've encountered. So conduct a research of the literature. Identify interventions that have been proven effective by previous studies. Remember, we are not creating something brand new out of scratch. The focus of the DNP project is to take what's already in the literature and implement it into practice. Okay, so it's taking something that's on paper, online, and actually implementing it into real world practice. That is our focus as a DNP. So look and see what interventions they've already done and what's already been proven effective in research studies, and that may be something you want to consider implementing at your organization. And look for those clinical practice guidelines. We have a lot of organizations that kind of regulate how we do healthcare, and they release a lot of clinical practice guidelines to help us improve outcomes and to better our practices. So that might be a good place to start if you're looking at a policy change or a practice guideline change in your organization. Look at those clinical practice guidelines. So once you have an idea of what you're going to do, you need to develop a PICO or PICOT question. PICOT. So let's break that down a little bit for you. The P in PICO, remember, PICO is a mnemonic derived from the elements of a clinical research question. So the PICO process begins with a case scenario, and it creates a question that is phrased in order to elicit an answer. So when you have the P for PICO, that is your population of interest. So who are you looking at? Who do you want to focus on? You want to focus on patients? Do you want to focus on nurses? Do you want to, making a practice change, right? Maybe it's something that the nurses can do better at bedside with regards to PIVs or with regards to CLABSIs or CODIs. Maybe there's a practice change that the nurses can do to fix that. So your P would be the nurses. Maybe you want to focus on caregivers, especially if you're dealing with a pediatric population. You want to focus on something with the parents. Maybe you want to focus on educators. If you're doing a DNP in nursing education, you can focus on the educators. You can focus on the students. So there's a wide range. So you need to figure out who is your focus. Who are the people you want to help? Who are the people you want to improve process? Then the I stands for intervention. So what do we want them to do? So we identified our population, but what do we want them to do? What do we want them exposed to? Are we going to do specific tests? Are we looking at a clinical practice guideline change? Are we looking at certain therapies? So this is really important. This is the intervention. What do we want our population to do? This is what we're going to measure, right? So the C stands for comparison. And what are we going to compare the intervention with? Is it going to be compared to no treatment, or compared to a different type of treatment? Or is it going to be compared to current practice? And a lot of times, if you're implementing something brand new, like a new clinical practice guideline, you don't have anything to compare it to because you don't have current practices. You just kind of do whatever you think is in the best interest. And I think that's where nurses are always at. We always want to do what's in the best interest. But now we're going to implement a clear-cut practice policy and guideline that nurses must follow, steps that they're going to have to follow. So that's your C is for comparison. Then you have O, your outcome. So what happens? Do we have improved data? Do we have improved fall rates, improved CODI rates? Obviously you want the rates to go down, right? We don't want increased falls, we want decreased. So decreased CODI rates, decreased falls, things like that. So the T component stands for time. Now time is not always applicable, but in some scenarios, in some DNP schools, they are. Like in my program, it was an 8 to 10 week implementation, meaning I had to initiate the intervention and I had to follow it for 8 to 10 weeks, and then I would take that data and look at the data to see what happened, what was the outcome. So time, it depends on the program, but you're gonna have to expect to implement between 8 to 10 weeks of data. And it also depends on your practice. You may do a retrospective type of practice project. So the time element can vary, but that I don't think is the most important part. While you do have to have time element because you're not in DNP school forever, right? So there is a time element, but it depends on your PICO exactly what that entails. So for example, my project was, does the implementation of a mindfulness-based stress reduction program. So that's my intervention, and I had to pick a program. There's so many mindfulness-based programs out there. I did pick a specific program. So, does the implementation of a mindfulness-based stress reduction program compared to current practice? And at my facility, there was no practice. So, I'm implementing something new at this facility. Impact compassion fatigue in healthcare providers. So my project was not specifically towards registered nurses. I was looking at all the certified nursing assistants, the LPNs, any healthcare provider that was in the organization. I included all of them in my study. So does a mindfulness-based stress reduction program compared to current practice impact compassion fatigue? That's what I was studying. I wanted to see if compassion fatigue went down after they implemented the program, right? So I was comparing before the program started, and I gave them a tool, a survey of what their compassion fatigue levels were at. We did we implemented the mindfulness-based stress reduction program for 8 weeks, and then I gave them the same survey at the end to see where, and compared pre-intervention and post-intervention to see where my numbers were, and hopefully that they decreased. So that is my that was my project. So with that, all this to say, a few things you need to keep in mind. You will need a population to study. Who is your focus? Okay. You will need an intervention. What are you going to want them to do? And then you're going to need a tool, some type of tool that is already out there in the literature. You're not creating anything new in a DNP program. You are not creating a new intervention, brand new, never heard of before. You're not creating a brand new tool, never heard of before. That is the focus of a PhD nurse, and that's what our PhD programs, and that's not what we're doing in DNP school. We are taking what's already out there and we're implementing it into our practice setting. So a population to study, an intervention. What do you want to do? What do you want to compare? What do you want to have them complete? And then a tool before and after to measure if it was effective. Another important thing to consider: does your organization have an IRB, an internal review board? If your organization has an internal review board, this can be a sticking point for a lot of DNP students, because this can delay your project. The sooner you have an idea of what you want to do, the sooner you develop your PICO, you need to go in front of your organization's IRB and ask and seek for approval. Now, this process can be time consuming depending on your organization. Maybe the IRB does not meet but once a year or once every 6 months. Now, that can be a problem if you only have a 2-year program and you need this done rather quickly. So the sooner you can get through your organization's IRB, the better off you're going to be, and hopefully not delay your schooling. Now, if your organization does not have an IRB, great, then you don't have to worry about it. But chances are your school, your DNP school, is going to have some kind of IRB review process that you'll have to go through. And that's okay. It's not nearly as stringent as an organization IRB, because the school knows that you're in a program, so they're not gonna, they meet regularly to look at student projects and things like that. So lastly, I do want to encourage you guys. This process is doable. DNP school was amazing. It was a great experience, a great learning opportunity, but I want you to be flexible. The process is iterative. It is changing. Different faculty might want you to do different things. They may want you to tweak your program. They may want you to tweak your PICO. Keep all those things in mind. Be flexible. Trust your faculty. Trust the process, okay? Remember, this is a learning experience. No one is expecting you to get everything right while you're in school. You're learning from this process. And then once you learn the DNP process and the quality improvement process, then once you graduate, you can go out there and you can do your own study. Now, granted, during DNP school, you are expected to do a project from start to finish. So it is going to be a process, but you may have hiccups along the way. Your data, may not come out to be what you want it to be, but it is a learning process, and that's okay. There's technically no right and wrong answers because it is a process. You learn from the process, so that way when you graduate and you're ready to take charge in your organization and make things better for your patients and your nurses, you'll have all the knowledge in your toolbox to implement your own practice change, and now you know how to do it because DNP school prepared you with all the steps on how to do that. So I hope you guys have a blessed day, and I'll see you on the next one. Bye.